Hello, everyone. My name is Courtney Szymborski, and I am the manager for the value-based care at Anatomy IT. Today, we're excited to bring you an important education around the crucial role of a HIPAA security risk analysis plays in not just your compliance, but also in maximizing your MIPS score. Our panelists will help you understand and discover the best practices and common challenges and solutions and components to help you achieve success. A few things I wanted to go over is that all participants are in a listen only mode. So please put your questions in the chat and we'll monitor those as they come in and answer as we can or at the end of the presentation. You will also receive a recording of this webinar sent to the email address that you registered within the next couple of days. Finally, if you haven't already, please consider registering for our 2 upcoming MIPS webinars designed to help simplify MIPS for ophthalmology and dermatology practices. Whether you're new to MIPS or simply just looking to optimize your performance, these webinars will provide key strategies and updates you need to succeed in 2025. We'll make sure to drop the links in to register at the end of the meeting. Now, let's go ahead and meet today's panelists. Today, we are joined by Don Miglino, our HIPAA compliance expert. Don, can you tell us a little bit about yourself?
Sure. Thanks, Courtney. Welcome, everybody, and thank you for joining us today. I am Anatomy IT's HIPAA compliance specialist. I have been doing this for many, many, many years. In my role, I conduct risk analyses for anatomy clients as well as non-anatomy clients, as well as hospitals, surgery centers, pretty much run the gamut. Could be a one doctor operation to a multi-specialty surgery center or a hospital. Most people really like me when they meet me. When I'm completing your risk analysis, you're probably very happy to see me walk out the door, but that's only because we try very hard to uncover every stone, unturn every stone, I think is the way it's put. But in order to ensure that hopefully you'll never have to go through an incident or a breach, God forbid. We'll discuss this a lot more during the webinar today and how perhaps we can give you suggestions and recommendations on how to help your organization stay more compliant.
Great. All right, and next, we're thrilled to be joined by Chris Wheaton from Abide, a partner of ours that also specializes in HIPAA compliance. Chris, can you share with the group a little bit about yourself?
Absolutely. Thanks for having me. I'm excited to be here. As Courtney said, my name is Chris Wheaton. I'm the Chief Revenue Officer at Abide. Abide's a technology company comprised of HIPAA and OSHA experts, and we provide education and solutions specific to the independent practice environment. So all day, every day, we educate practices on their roles and responsibilities, whether you're an office manager, practice owner, doctor. We lead with education, and then we have a really easy to use solution to automate the entire HIPAA compliance process. We work with about 4,000 practices across the country, large and small, not in the hospital space, but more of in the independent or multi-location practice environment. Really proud of our partnerships, obviously Anatomy IT being one of them. Obviously, we work well together in terms of helping practices protect themselves from any type of HIPAA violation. The other great thing is we're partnered with dozens and dozens of associations, buying groups across the country, across all verticals. And that's really led us to some really great growth over the last now 8 years. December 23rd is our 8-year birthday. So just really excited to be here and help educate you all on the security risk analysis for your practice.
Great. Thank you, Chris.
Yeah.
All right. Now, we're going to look at the agendas for today. So first, we're going to start with understanding the HIPAA SRA essentials, identifying common challenges and uncovering best practices, simplifying compliance, and protecting against penalties. So let's get right into it with understanding the essentials. I'm going to start with Dawn. Can you explain why a HIPAA security risk analysis is so essential in today's healthcare environment? And what risks does it mitigate specifically for patient data?
So, as you all know, and nobody has to say anything, as soon as someone says change health, we all get it. cyber criminals prey on healthcare organizations because there is a huge value to patient data, medical information. And we don't do a good job of securing our business environment, and they know this. So when you're looking at it, you say to yourself, well, why? Why would somebody want my ophthalmic pictures or my images? There is so much information that's valuable within a medical record. OCR had stated recently at a conference that one complete patient record, Courtney's complete patient medical record, is valued at $10K on the black market. So that's one of the main reasons.
Yeah. Just to jump in here, Donna,
Yeah.
I think we were both at that same OCR event in DC. And yeah, the interesting thing that I thought they said was the complete patient record is valued at 10,000, but it's the credit card number that everybody thinks it's so valuable that's worth like 90 cents on the black market, right? And then the social security number is like $1.20. So yeah, just a huge misconception on like the value of the patient record. So we always say you're in the data business. As a practice, you have to protect that data because it's the value of your practice, your company, right? So yeah, I'm echoing Don on this. And the OCR really, cyber criminals are lazy, their words, and go for the lowest hanging fruit. Right now, it's the healthcare industry. I'm sure, Don, you just saw the announcement about 15 minutes ago. They just levied another fine, $1.1 million for a pain clinic. And the major cause of that is the security risk analysis. So super interesting. I think some other interesting data that the government came out with in their 2020 audit release was 86% of practices have not completed the security risk analysis to their standards, right? So not only is it, of course, part of the MIPS requirements, but it's overall the first step in HIPAA compliance and often overlooked. It's definitely important to have educational events and webinars like this to get the word out so practices, large and small, can understand their risks for not completing a comprehensive SRA.
Great information. So for organizations that are new to SRAs and what the key components are, what should they prioritize to ensure that they're aligned with HIPAA compliance?
Yeah, absolutely.
Yeah.
Yeah, happy to jump in. I mean, the three key components of an SRA are the three safeguards: technical, physical, administrative safeguards. Some, elementary examples of the administrative safeguards would be like policies and procedures, how often your practice is training doctors and staff. Got to train doctors too. Business associate agreements with third-party vendors that access protected health information, a comprehensive disaster recovery plan, and much more. Physical, some examples would be physical locations, the physical location security, like for example, like locks on doors, alarms, individual codes, key fobs, of course. Do you have a dedicated room within your space that holds medical records or servers? Making sure there's limited access to this area. And then, of course, proper disposal of protected health information or electronic protected health information in place, making sure you're disposing of that properly. And then finally, technically, obviously, if you're an Anatomy IT customer, you're pretty well safeguarded here. They do a great job there, but I think the main point here is like you want to document that in the security risk analysis. Of course, Dawn's going to help you do that. But in addition to make sure, strong password policies in place for all systems, firewalls, additional security licensing, two-factor and multi-factor authentication, wireless access points. And then that one big thing that Dawn mentioned before, Change Healthcare, that everybody's heard about, that whole breach started because of they didn't have multi-factor authentication, right? So it's just some of the basic things that y'all need to protect data and make sure you protect yourselves in the event of some type of breach or investigation.
And I just want to add to that, everything that Chris had said, of course, is correct. You also have to understand that there are specific things that can be done that may not necessarily be a money thing, so to speak.
Correct.
Do we lengthen our passwords? Is that going to cost us money? Do we go to our IT and say, I want to change my password from 8 characters to 13 characters? Sure. It's things like that. Physical, do we put one lock on the server room? Do we quit using it as the storage room or the cleaning company's storage room? So there are things specifically, especially when we're talking with a smaller organization that might have limited funds, You can't, number one, just throw your hands up and say, I don't have the money to do that. That's not going to fly with HHS OCR in the event of an incident. But what you can do is you might be able to say, well, maybe if I position the screens this way, I wouldn't have to buy privacy screens. Or maybe if I put a key code lock on and I gave it to Chris and Courtney and Dawn, and that's it. And nobody else has access to that medical records room or the server room. So just some basic suggestions on that.
Yeah, those are great suggestions. Thank you, Dawn and Chris. And yeah, so then we wanted to go into what are some tangible benefits that healthcare organizations can experience when they commit to regular SRAs?
Yeah, happy to answer this real quick. In general, I mean, we always say it's just good business practice. So whether or not you agree with the government enforcing these laws, right? Like we hear this a lot where practices, hey, it's just a thorn in my side, right? Like they're not letting me do my business of providing good healthcare. Just simply not true. Number one, number two, like it is actually good business practice. So it's a great way to make your business more efficient overall. Communicating with team members and of course patients to mitigate any breach or risk is going to protect the bottom line of your business, right? And of course, it's incredibly important to just know where all of the protected health information is located, how it's secured, where the vulnerabilities are within the organization. So again, overall, I like to think of it as just good business practice, something that every practice obviously is required to do, but just should be doing with that mindset.
And I want to add to that, the risk analysis, the SRA, would be the first piece of information that HHS OCR would ask for in the event of an incident or a breach. You have to remember that if you have one patient complaint to OCR, they have to investigate it. They don't have a choice. They're not looking to give breaches out as Christmas presents or as holiday gifts. They just get dropped in their laps. So when you're thinking about that, as Chris mentioned, it is the best business practice you could possibly do. However, it also is a HIPAA requirement. And if you cannot produce that, just like, what was it, Gulfstream? Chris, is that what Gulfstream or Gulf Coast that just had the
Gulf Coast.
breach?
Yep.
Yeah, so this breach, the very first thing they list is failure to complete a security risk analysis. So automatically you're going to be fined with that.
Yep.
In addition to that, when you're conducting MIPS and you're completing MIPS, one of the boxes that you're checking is, I did my risk analysis. And I will tell you that I have known clients that this has happened to. For whatever reason, the CMS or whomever wants more information. So guess what happens? We want to see a risk analysis. Uh-oh. And then in addition to having their incentive payments revoked, there could be a penalty attached to that or a fine attached to that.
Yeah, great points. All right. And then we're going to go on to our next topic here, identifying common HIPAA SRA challenges. So what are some of the most common challenges that you guys see in healthcare organizations and what they face when conducting an SRA, especially in smaller or resource-limited practices?
I mean, we see it all the time. I think we always, in our CE courses and our one-on-one consultations, we try to overcome just common misconceptions. Some of the common misconceptions we hear is that the SRA is a one-time thing, right? It's a one and done practice. You don't have to ever really do it again. We talk to doctors all the time. Hey, I did one, 10 years ago. Okay. You got to update that. Or, hey, I'm a small practice. I don't need to conduct an SRA. I don't have any risks. I don't deal with a lot of patient data. That's just completely false. We've heard that practices think their EHR practice management software conducts the SRA for them. That's a big reason why we've partnered with practice management companies, because they don't want to hold that liability. Or again, it's just a simple checklist, something that you can, of course, you're checking the box, you're attesting to it as, when you're testing the MIPS, you're checking that requirement, but actually using just a checklist that's going to check the box with your SRA is just simply not the case. You have to assign risk level, which we'll get into and all that good stuff. So really the challenge is educating owners, doctors, office managers on what the SRA is. So as a healthcare professional, we always say, like, how are you supposed to ask yourself the questions the government requires you to address if you don't know where to begin? And again, I think like, teaming up with Anatomy IT and, the message that Don and I will be talking about throughout today's webinar is just so important for the awareness piece and then to actually implement something and show progress. So Don, I'm not sure if you want to add anything there.
Yeah, please. Thanks, Chris. What ends up happening sometimes is people focus on one or two specific areas, and they say, I did my risk analysis. Is my firewall okay? It's not 10 years old. It's going to be end of life soon, but it's not yet. Or most organizations are very good at terminating or terminations and resignations and removing or disabling users in your EMR or your practice management systems or any of the systems and applications that contain EPHI. What about the other systems? What about Windows? What about legacy systems? Software dictation? Those are the kind of things that, we have to look at, because we can't have blinders on and we can't make a decision that I have all my policies and procedures and I do HIPAA training once a year, I'm good. No. Or all my technical is covered. I have been in organizations, and I'm sure Chris can attest to the same thing, where we see people are so proud of some of the things that they've done, and yet they're overlooking the fact that there's no physical security measures within the facility. Or the back door remains open because it gets hot in the summertime and we like the breeze in the spring, and in the server room's right next to the back door and it's wide open. So there are things like that. The other thing I wanted to mention, when you're faced with doing the risk analysis, is there are options. You have HHS OCR's DIY or do-it-yourself security risk assessment. It's available. All you have to do is Google it. The reason that we exist, why Abide exists, why Anatomy IT exists with security risk analysis, is it's got to be comprehensive. We have to cover all the bases. As Chris said before, we have to cover all the safeguards. So that the do-it-yourself security assessment is good. And OCR will tell you that's a really good starting point. But they won't say it's soup to nuts. We got it all covered here. And it's very, very important to understand that. So the challenges, I would say, probably going back to the original question, are going to be, you got to take baby steps, and you have to look at all those categories, and you have to think of where all the PHI lies, and not just electronic. It has to be physical too.
Totally. And then one thing just to jump in, that OCR DIY, again, great tool. I mean, they're updating it constantly. That means they're taking it serious, right? But I think like the big thing is there is a disclaimer on the website, like seek third-party expert advice. Make sure you have a HIPAA compliance officer within the practice. You're working with third-party professionals that know what they're talking about, whether it's, again, Anatomy IT, Abide, whoever. But make sure you're going outside your organization to double check, because that is a tool for you to use, but they're not going to guarantee that you pass an investigation if you have a breach or a complaint just by filling out that tool. There's other steps you have to take. So I think that's important to say, and again, not discouraging anybody to go use that. I think it's like, by all means, go use it, right? But just make sure you're aware of that bulletin.
Great, thank you. And I think you guys have covered some of this, but can you go, a little bit more into why you think so many organizations struggle to complete an SRA effectively? And what are the most frequent mistakes that you guys have seen?
Organizations handling EPHI or PHI need to concentrate their efforts on how they can secure the environment and patient data from regular training. We always used to say HIPAA training, at minimum on an annual basis. Well, that's not good enough anymore. And what even more so important is cybersecurity awareness training and security awareness training, because your staff is your front line, and you absolutely need them to understand, what are the red flags in an email phish? How do what does it mean when I get an attachment in an email? What about this? What does smishing mean? What is there's so many different things, but it also applies to their personal lives. So when Dawn goes to Courtney to train her, and Courtney goes, I'm tuning her out. I've had it with that. I bring it to her level and I say, look, you're going to go home tonight and you're going to do your banking, your online banking. You got an email from Wells Fargo and it says, hey, sign in because we've got new bells and whistles, and put your unique user ID and password in, and we're going to download all those security measures. No. So try to engage in that. Again, strong passwords. We talked about that earlier. Passphrases, fantastic. Long passwords. I think if you thought about what you had to do in your daily life, your patient portal, your 401k, your own online banking, now when you go to create a new password, you create the password and it goes, that's not long enough. Nope, we need 14 characters. So it's really, really important. A 7-character password statistically can be cracked in 2 minutes. It's that easy for the hackers and the threat actors. Two-factor, multi-factor authentication, Chris mentioned it earlier, whenever possible. It is an ideal scenario. So it means it's not just the password, it's also what I have. So who am I? So it's my cell phone. So I get a push to my cell phone. Most of us use this on some levels. You're signing into your financial institution and it says, where do you want your push to? Where do you want your code to? So it's things like that. Again, documenting policies and procedures and updating them. It's not good enough to make them and create them. And then Chris comes in or I come in to do your risk analysis and you say to me, well, nothing has changed since 2019. An auditor walks in the door, you have an incident. I'm going to tell you straight up, OCR is going to say, you can't tell me nothing's changed since 2019. So it's very, very important, and also to always include your staff when it's applicable. So if you're changing your HIPAA policy, or you're changing your acceptable use of information, what I can and cannot do with my business devices, you want to have them included. You need them. You need their support, and you need them to understand what the organization expects of them.
Yeah, I love that employee participation, right? Like making sure that the team at your practice feels comfortable saying something if they see something, if there's some type of incident or if they have a breach, if they click on something, right? Like they need to be educated through that cyber awareness training. Of course, they need to document that on your SRA. But overall, I mean, the SRA, it's a daunting task, right? It's the first step in compliance. It's obviously a huge, it's a part of the MIPS attestation. So again, you got to make sure you get it done. So just because it's daunting or might become overwhelming doesn't mean you can't do it or you shouldn't do it. So a big thing we see is just using a checklist or never fully completing the SRA ultimately gives them a great way to implement a risk mitigation plan. So the goal is not to just get the SRA done and it's one and done, right? You got to have a mitigation plan in place because, as Dawn mentioned, your practice has new technology in it from 2019, 2020. You're going to continue to implement new technologies. An elementary example of that would be like Windows, right? They're the new operating systems that are going to be HIPAA compliant. That's like one example of many different solutions you're going to be implementing over time. And another frequent mistake is that a practice may have completed SRA years and years ago. Like I said before, never updated it, don't even have access to it. Right now, we're going through an investigation with a 7-location practice that had a ransomware attack. Before they implemented our software, Abide. I'm not even sure, honestly, who they're working with on the MSP IT side. But the point of this is they are a 7-location practice. The OCR, Office for Civil Rights, is asking for an SRA through the last 6 years. Okay, so the breach could have happened. It doesn't matter. It happened last year, but they're still wanting to make sure that they're doing things in the lead up to the breach. And if they don't, do they have corrective action after the breach, right? So there's a lot of things that you can identify pretty quickly in that original SRA, and then ultimately update it throughout time to protect your practice from any type of incident in the future. So great starting point. It's overwhelming, it's a daunting task, but you got resources at your fingertips with of course Anatomy IT and Abide and outside of us as well. But just start getting one done, start trying to mitigate risk and show that action plan.
Yeah, great. All right, so next we're going to go into uncovering HIPAA best practices. So what are some best practices that you guys would recommend for conducting a comprehensive SRA? And are there particular areas an organization should receive more focus on?
Sure. Yeah, I mean, I think establish a clear scope, identifying all systems, apps, and data within the practice. Um, Assemble or assign a team member or multiple members, as Don was saying, to include different stakeholders, right? Get different perspectives across different teams, departments. I mean, even if you're a five employee practice, eye care practice, you could include, to Don's point, your front desk, your office manager, and the owner, right? It gives a good understanding and overall accountability of the team. And then as you identify potential threats and vulnerabilities across those three safeguards that I mentioned, assess and develop your mitigation strategies. And then some ideas for areas of focus would be data, network, and cloud security, third-party management, and physical security. Ultimately, adhering to overall HIPAA compliance requirements is important.
I want to add to that because Chris hit it home very interestingly with a smaller practice. So you have your owner and you have maybe your DON and you have an administrator and then a small staff. When we talk about HIPAA and we talk about SRAs, nobody wants to do it. Nobody wants to do MIPS. It's a pain in the neck, but it is imperative that it gets done. It's a necessity, and it actually is a benefit, as Chris mentioned earlier, to the practice, because you really are looking at how you can better the organization and how you can keep yourself off the HIPAA wall of shame, basically. But when you have a team, it doesn't necessarily mean as small as the organization might be. It shouldn't fall on one person. Include someone else. You might have someone that loves to write policies and procedures or review, or they're great at grammar, and so they can review the policy that you wrote and they can edit it if necessary. HIPAA training, a big one. Who's managing that? Do we do a once and done? Did somebody fail? Did anybody follow up on that? Really should not be a once and done. But share the wealth, basically, is what I'm saying. So, 1 month, Dawn is responsible for coming up with some kind of HIPAA training for the monthly Friday luncheon that we have, or quarterly. There are so many free tools out there and videos and things that can be offered up to an organization that may have limited funds. So you all sit around and you watch this. Just ensure that you document anything that you do in that category. But again, going back to what I really wanted to say was about the team and what Chris said about the team. Utilize other people within the organization. That's really how you're going to get this done.
Great. Yeah, and when assessing risks in healthcare settings, how can organizations determine which risks are the highest priority?
Well, you have key areas that you have to look at, such as outdated or end of life devices. They run with no security measures whatsoever. So you're talking about anybody could easily, if they're good at this, hack into one of those systems or applications. Password policies for all systems and applications containing EPHI. This means devices, this means Windows, this means your EMR, your practice management, your legacy systems. MFA, as we talked about before, multi-factor authentication. It's a layer. It's another level of security that your organization can have. And change your old ways. We have a Windows 7 computer. It still runs on the network. You can't do that. It's not good practice. You're going to have an incident. So you need to go back to whomever manages you with IT and say, I need to get this off the network. How do we still run this? There are ways of doing this. And we're not talking tens of thousands of dollars. What I've run into in the past is someone will say to me, sure, we can get that to Windows 11, but it's going to be $150,000 to replace the device. I get it. But we have to change our ways. We have to figure out an alternative to that. Conducting the annual SRA uncovers these risks. It shows where these areas are. And what you want to do is you want to look to your high and medium risks first. If I have a shared user account still, I still have a front desk. I still have a nurse. Those are the kind of things that have to be addressed immediately, because in the HIPAA world, it's not acceptable. Chris, what do you want to add to that?
No, I mean, I think you're nailing it with everything, right? Like it's just there's so many stories we could tell. To
I
me,
know, and sad stories, right?
yeah, it really is. I mean, we're like, we always say we're all patients somewhere. Um, and yeah, the highest priority to me is, of course, going to high, medium risk, but like, I mean, you mentioned the $110,000 device, right? Like there's, especially in the ophthalmic industry, the devices we're talking about have Windows operating systems are like OCTs, there could be topographers, the, I forget his name, but HHS, NIST conference that we were at in DC, the guy that literally works for the OCR that helps enforce these laws went to his ophthalmologist, and they're like, "Oh no, I just unplugged my topographer. Yeah, it has Windows XP on it, or it has Windows 98, but I just unplug it." It's like, no, like that's not how it works, right? So I think,
Yeah.
I think it's like an understanding, making sure the government doesn't think or doesn't require you to be absolutely 100% perfect. That's not what they're asking. They're asking for you to identify and then implement solutions realistically. And guess what? As Don mentioned, if you are running Windows 7, you have to figure out a solution. You have to address it, and you have to have a plan in place. So, in the event of some type of attack, some type of malware, or some type of ransomware attack, data breach, you have to be able to prove that you're doing everything you can to mitigate risk. So, I could talk about this stuff all day. I love the back and forth here, but I think you nailed it with everything you said.
Yeah, and we do have a question that came in. If the completed SRA shows multiple opportunities for improvement, how does that impact the practice with regards to regulatory agencies like OCR? And will that leave us with open to sanctions or fines while addressing them?
It's a great question. Um, so it isn't a matter of you conducting your risk analysis and having to remediate or mitigate your risks like that. What OCR really looks at is that you're taking those steps forward. So in other words, you do your risk analysis this month and you have 5 high risk areas and you start addressing them. You don't take the report and shove it into a folder until you hear from Chris or Dawn next year around November and we go, hey, oh, it's time to do your risk analysis again. You go, oh no, oh crap. So then when you're looking at them, you start the process and you really have to determine with your team and with your organization what are the highest priorities here and what are the biggest risks and how we can start addressing them one by one by one. Is it email encryption? Do we need email accounts because right now everybody's using Gmail with no encryption? Really super dangerous, very, very dangerous. So, do we take on 3 people and then we train the rest of the staff that they understand they need to go to these 3 people that have email encryption in order to send EPHI? That's one example. Second portion to answer the question, no one is going to come after you. I think sometimes that is a fallacy. When we talk about risk analyses, people say, well, I don't want to do it because then I'm really throwing up red flags that I haven't done any of this stuff. That's not what they're about. They're about assisting. That's why we have all these new cybersecurity teams and organizations, CISA, we have NIST, we have HHS 405D. There's so many great things out there that's free. They want to help us. They really do want to help us, but we also have to begin to help ourselves. So would they come back and say, you didn't do a risk analysis for the last 3 years, but you did one this year? You're going to get fined for the last 3 years. It doesn't work that way. So I want everybody to take a deep breath on this call or on this webinar and say to yourself, okay, tomorrow's another day and I'm going to start doing some things right. I'm going to start fixing some things.
Yeah, I mean, I think they they would rather see you do something. They don't necessarily care more as much about the high risk. Like they'd be, I think, excited for you to identify high risks, right? Like that's the point of the SRA. They're not knocking on your door. They're not, there was a random audit campaign back in 2016. They might be doing some random investigations now, but the point that Dawn's making, and I think it's such a great one, is like it's more serious not to do anything, and not to have a risk mitigation plan in place after doing an SRA than having 50% of your SRA all high risks, right? Like we have to address those, and that's again like the hardship of it. It's how do I ask myself questions that I don't know what to ask, right? So it's like, that's why you want to get educated. That's why you want to try to take this on, and seek resources. So yeah, I love that question. It's an important one. Don't just put in email encryption and, like, think you don't have to do an SRA. Don't just, implement a HIPAA compliant telehealth solution and think you don't need to update your SRA. Like, that's not how it works. It's quite the opposite. Identify you're using a non-compliant Gmail, and then show progress on your SRA. Hey, we did go outside. We did use some type of encryption, upgrade the license, and we're trying to protect data. That's the point of it.
Great. Thank you guys for answering that. We're going to go on to the next section, simplifying compliance. And I want to start with how can partnering with a specialized company ease the burden of conducting an SRA, particularly for organizations with limited in-house resources?
So I'll start with that one.
Yeah.
If you're in an organization and your resources, and I think by your question, Courtney, you're talking about manpower, correct?
Yeah.
Okay. So, in that scenario, like we talked about earlier, try to bulk up your team. But if that's impossible for you to do, then that's when you need an abide or you need Anatomy IT, because we're going to go in and we're going to do all of that for you. If it's a daunting task, and you don't have the time or you can't identify, you need experts to do that. You need somebody to come in and say, do you have all of your business associate agreements? That's one of the really important ones. I work with you and you work with me, and we don't have a business associate agreement in place, and Anatomy IT causes a breach. We're both going to get fined. But you have to think outside the box. You have to think of your leased copiers. You have to think of your medical devices. You have to think of, do you have any consultants that you're using that are third parties that are not employed? Again, you want to think of anybody who's touching that PHI. And it isn't just software. It isn't just EMR and practice management. So you got to look at things like that. Again, you hire a company, an organization, a third-party organization to conduct your risk analysis. They're going to dig deep into the firewall, check the firmware. What is the firmware up to date on the firewall? Does it need additional licensing? Your wireless access points. Two things. We have a guest wireless and we have a network isolated. On the guest wireless, who uses the guest wireless? Well, our patients do. Okay, does Dawn's, who's one of the employees, does her iPhone or her iWatch sit on the isolated /network? Not good. And those are the kind of things that we dig into that you might not uncover, and it might be something that can be a no-brainer to fix, but could be a very, very dangerous scenario if it got compromised. You got the man in the middle situations. You've got people coming into the network. There's, you have a virus or a malware on your cell phone, and you plug it into your computer to charge it. It's a no. It's a really bad idea.
Yeah, and if I can expand a little bit more, I think like it's a cost of doing business at this point, right? Like the data that you hold is so valuable, as the government has pointed out, 10,000 for complete patient record. But it's not just about potentially fines and corrective action from the government and the law. It's reputation. You're talking about potentially having to pay ransom to a cyber criminal. So again, like you got, like, as your business grows, as your protected health information, your data grows, that is money in your business that you're going to sell one day, right? Or maybe you're going to pass down to your children someday. Maybe you want to buy other practices. You want to be a multi-location. You want to open new practices. So it's really good, again, practice to just understand risks and vulnerabilities and have that tightened up. So guess what? In the back of your mind, if there is an incident or if there's any type of question that comes up, you have somebody kind of waiting in the back that has simplified that process for you. So yeah, Dawn's absolutely right. Absolutely, it's something that you have to take on as a covered entity. It's the responsibility of the practice, but there are amazing tools out there. Obviously, going to pat Anatomy IT on the back and of course Abide, but it's something you have to take on. It's just a part of the healthcare space at this point.
Doing business. Yep.
Yeah. All right, you guys have done a great job on going over the simplifying the compliance, I'm going to actually go through to protecting against penalties.
Yeah.
And one of the questions there I wanted to ask was, once an organization completes their SRA, how should they prioritize their findings to improve security and prevent future breaches?
Yeah, I mean, we've been kind of talking about it a lot this whole webinar. Obviously, addressing high risks first, but likelihood, impact, overall threat level, things that you have to consider on an SRA, right? So, there might be a scenario where the likelihood or maybe the impact level is not as high as another question you're trying to answer, another solution you're trying to implement. So just making sure that you're doing it correctly. You're prioritizing well, you got to, number one, you have to first determine what risk level it is, especially if you're using the government tool, or if you work with a group like Anatomy IT or Abide, like we'll do that for you, and then we'll help prioritize it. But like that's the thing, you got to make sure you're allocating the right risk to whatever answer you're giving to that question in that safeguard, right? And it's going to help prevent future breaches. That was the message from HHS. This will help prevent future breaches if you understand where your data is being held. Again, nobody's perfect. So in the event of a breach, the important thing is to have the SRA, a plan in place, and know what to do next. Obviously, if there is some type of breach, have a breach risk assessment ready, and a formal report that you can hand in the event of an investigation, or you actually have to report it based on the amount of data points or patients that were affected. So, yeah, again, I think we, address high risk first, but you still want to come back to the low risks over time and make sure those are still low risks.
I want to just add to that, when you're talking about protecting against penalties, if you are conducting your risk analysis on a regular basis, on an annual basis, and every year it looks exactly the same, you're not protecting yourself against penalties. We consider this willful neglect in the HIPAA world. Mm-hmm. So like Chris's scenario of the 7 locations and the last 6 years of SRAs, if those 6 years of SRAs look identical, OCR is going to come back and say, what the heck? What were you doing? So that's one really good way to protect against penalties.
Absolutely. Love that point.
Yeah.
The willful neglect thing is huge. I think we don't talk about that enough. When you identify risks and vulnerabilities and you neglect to put anything in place, they consider it willful neglect.
Yeah, and then Don, for those that have checked the box on their MIPS SRA, what happens when they get audited for MIPS and they ask for the SRA? I know you kind of went over that a little bit, but can you go into that a little bit more if they just start checking that box?
Sure. So, there are different scenarios, and we have some fabulous links at the end of the webinar that are going to enlighten you a lot more. Courtney mentioned earlier at the beginning of our webinar that we have 2 MIPS webinars coming up, and I think it's both in December, Courtney?
Yeah. Yeah.
Okay. Really, really good information, but you have to check that box for MIPS, right? And in addition to that, there are scenarios like the 90-day consecutive reporting, minimum measure requirements to avoid a zero NPI. So that includes attestation statements. It includes numerator data of at least 1, exclusions if applicable. If you check the box, you better have it done, because you don't want to come up short with that. Because, again, and it isn't, Chris mentioned this earlier very quickly, it isn't, and I'm not sure about MIPS, but I'm going to guess if it's government, it's going to be pretty identical. You're going to be under the microscope then. So next year, it's going to be a whole lot harder. It's like if you were audited by the IRS. You think they're going to go, okay, well, you were really bad this year, but you're going to be okay next year, so we're going to ignore you. It's not going to happen that way. There's going to be corrective action plans, and there's going to be fines.
Awesome. All right. So just a few other questions. How often should an organization update or conduct a new SRA? I know you said if it's been a while, they need to be doing that. So what triggers the need for a reevaluation?
So we live in a digital world. We change pretty much, it seems like monthly. if not more, or maybe quarterly. But we go from a server on site to a server in the cloud, or the EMR in the cloud, to Microsoft Azure or AWS, or we're now using email and everybody has MFA and they can get their emails from their cell phones. Are we keeping up with all of that? And again, we hear this all the time. Chris and I heard this, in DC in October. HHS OCR states, if you're not conducting an annual SRA, you're not aware of the threats and vulnerabilities to your organization and ultimately your patient's data. And that's what you are responsible for. And like Chris said earlier, we're all patients somewhere, right? We want to be treated the same exact way. And your staff needs to understand the environment that we live in, the healthcare environment. It's tough, but we have to be so ultimately committed to keeping that data secured.
Great. And then, Chris, can you talk a little bit about what the risk analysis initiative is?
Yeah, they've had many initiatives over the last couple of years, especially since COVID. One, patient right of access, but the one that we were kind of excited about as a compliance company, which we've been almost asking for a while, is the risk analysis initiative. So the OCR stated in their October 2024 meeting that they found that many healthcare organizations were failing to conduct adequate risk analyses, leaving them vulnerable to cyber attacks, right? Which Don just mentioned, and data breaches, thus launching a formal enforcement initiative to focus on covered entities and business associates. So business associates aren't out of the, they're not out of the bag as well. Like they're going to be tossed into that initiative. So as Don mentioned before, making sure your third parties are they're compliant, or they're satisfactory compliant in your eyes. Signing a business associate agreement, you can even ask them the question like, how do you guys protect patient data? Are you doing a security risk analysis? Because again, the government is going to hold covered entities and business associates alike accountable. And then, the big thing is they recently announced last month their first enforcement action, resulting in a $90,000 fine. So they're taking it very seriously, and we can definitely expect more action soon. And it's an initiative that could last months or it could last years, like the patient right of access initiative.
Great. And then, Dawn, can you explain how the Safer Guide Act impacts the practices who participate in MIPS in 2025?
Sure. So CMS came out with the Safer Guide. Some of you are probably familiar with it. There's a lot to it. What I have dealt with and what I have worked with clients on is the high priorities. And it's really important that it gets done because it's another one of those things that has to do with MIPS. And it's really what I found very interesting about it when I started delving into it was that it's very good because it uncovers information that you might, as a clinician or as an administrator or as an owner, not know about your EMR. And so your IT gets involved. Your depending on if you use a third party like Anatomy IT to do the Safer Guide for you, and your EMR has to be included in this because there are some levels. And what it ends up doing, it's like doing the SRA. It's a good thing. It's a really good thing because if you find out that there's a category that isn't really necessarily covered or the EMR doesn't really quite meet the standards for the Safer Guide, it's important. It's very, very important.
Great, thank you. And I just wanted to open it up to the rest of the group to see if there was any other questions that any of you guys had for our panelists. Feel free to put it in the chat.
All at once, everybody.
Yeah. Yeah, if you have any questions, you can raise your hand or put it in the chat, I believe. So.
I think if you want, you want both me and Chris to just hit home again. It's not, it's not the government beating you up. It's a matter of you benefiting and securing that patient data. And as Chris mentioned, Okay, take off the table this. Take off the table of the fines and the violations, right? Or the corrective action plan that you're going to be under a microscope for 3 years. Your reputation.
Mm.
I know and you know, if one of your physicians or one of your docs or one of your orthopedists had a breach, would you think twice about going back to that office? Maybe. I know I would, but that's just me. So we really want to ensure that we're putting our best foot forward in addition to obviously subscribing to the HIPAA security rule and abiding by it.
Yeah. There is a question about larger organizations. Do you guys have any tips or tricks for the larger groups?
Yeah, I mean, Don, you can probably expand. I mean, when we work with larger, we don't work with hospital systems, but when we work with like larger multi-location ophthalmology groups or DSOs across the country, we work with 70 location DSOs. It's about going location specific and making sure you're empowering each location to address physical safeguards. Some of the administrative stuff might be, across the enterprise, but just empower your people, right? Like there again, to Don's point, this is not meant for you to get scared that the government's like out to get you. No, they're just asking you to do simple things like wear your seatbelt when you're driving, right? Like little things that you can do at a location specific with your team to ensure that you're protected across the organization, because you'll look at different fines. You just Google Great Expressions dental, right? In the dental space, when it comes, they one fine 90,000 or 80,000 maybe for one patient complaint. Was that location empowered in Georgia, right? Did they have the policy and procedures? Were they aware of risks and vulnerabilities? So I think it goes back to employee participation, that psychological safety. So, when you're, if I'm working at one of the locations for a larger organization, I want to be able to say something and make sure you have that process in place and that communication in place with training, the SRA, policies, procedures, all the above.
So to add to that, I'm going to start with multi locations, then I'll go to larger organizations. Very briefly, multi locations. Chris hit it right on the head, because let's say you acquire another organization and they're still using an old practice management solution. They're not yet on your EMR, or you put them immediately on the EMR. It's not even just the physical, it's the technical. It's what are the security measures? Is the notice of privacy practices up to date in all of the locations? Is the person that's the compliance officer or the key, contact, did that person retire 7 years ago? I just ran into this last week. There are things like that, especially multi-locations, that you really have to put someone in charge. You have to put a team together in a situation like that. In a larger organization, depending on your funding, in one way of the funding is to really educate your C-suite, really acknowledge to them and show them the OCR wall of shame, and show them the newsletters that come from OCR listserv on the right of access fine that just occurred, and the $1.9 million fine that just happened this morning. It's things like that. So you have to get them involved, and then you really have to dig deeper, because you can't just look at the basics when you're looking at a large organization. You have to look at all of the systems. You have to look at the Internet of Things. You have to look at the medical devices. Mm-hmm. You have to look at AI within your organization. Telehealth. What are the things that we're still using, or we've used and we don't use anymore, and we still have activity in them? Or we still have, we're still using something on the web that we've got 175 users, or we have 175 remote users because it was COVID and pandemic, and they still have that access. They still have that activity, and that connection is still active when it's not necessary anymore. So I hope that helped.
Yeah, thank you. Yes. And thank you guys all so much for joining us today. Again, just a quick reminder that we will email out a recording of this webinar in the next couple of days. And we invite you to register for those 2 upcoming webinars that we have tailored to simplify MIPS for ophthalmology and dermatology. And whether you're navigating MIPS for the first time or aiming to enhance your performance, the sessions are there to equip you with the essential strategies and the latest updates for success in 2025. So with that, I'm going to go ahead and wrap it up. And you guys will get that email with the recording of this webinar. All right. And there's also some links in the chat for you guys to check out too.
Thanks, Courtney. Thanks everyone for joining today.
Thanks for the opportunity.